Increasing trends of prediabetes among adults. What is the answer? Welcome back. In this video we will explore the growing trend of prediabetes in adults and what can be done. The prevalence of prediabetes has been steadily increasing globally. In many countries, a significant proportion of adults have prediabetes. The exact numbers vary by region, but it is generally considered a growing issue. Sedentary lifestyles and the obesity epidemic are strongly associated with the rise in prediabetes cases. Lack of physical activity, poor diet, and unhealthy lifestyles contribute to the increasing number of individuals with prediabetes. Prediabetes is more common as individuals age, especially in those over 45 years old. Age-related factors and changes in metabolism can increase the risk of developing prediabetes. Common tests to diagnose prediabetes include fasting plasma glucose (FPG) test, oral glucose tolerance test (OGTT), and hemoglobin A1C (HbA1c) test. These tests are used to assess blood glucose levels and determine if an individual has prediabetes. Prediabetes increases the risk of developing type 2 diabetes, heart disease, and stroke. Managing prediabetes through lifestyle changes such as a healthy diet, regular physical activity, and weight management can significantly reduce the risk of developing diabetes and related complications. There are several tests used to detect prediabetes in adults. These tests help identify individuals with higher than normal blood sugar levels but who do not yet meet the criteria for a diabetes diagnosis. Early detection of prediabetes is crucial for preventive measures to reduce the risk of developing type 2 diabetes and associated complications. Here are the common tests used to detect prediabetes. Before we dive into this further, would you please hit the like and subscribe button? This helps our channel to grow and get more important information out to the public about type 1 diabetes. Now, here are some of the tests used to screen for prediabetes. Fasting plasma glucose (FPG) test. This test involves fasting for at least 8 hours, usually overnight. A blood sample is taken in the morning before eating. A fasting blood glucose level between 100 and 125 mg per deciliter, mg/dl, is indicative of prediabetes. A level of 126 mg per deciliter or higher is diagnostic of diabetes. Oral glucose tolerance test, OGTT. After fasting overnight, a blood sample is taken. Then, the person drinks a sugary solution, glucose drink, and blood sugar levels are tested at specified intervals, usually 2 hours after drinking the solution. A 2-hour blood glucose level between 140 and 199 mg per deciliter is indicative of prediabetes. A level of 200 mg per deciliter or higher is diagnostic of diabetes. Hemoglobin A1C, HbA1c test. This is perhaps the most important test for diabetics or to determine prediabetes. This blood test measures the average blood glucose levels over the past 2 to 3 months. Interpretation: an HbA1c level between 5.7% and 6.4% is indicative of prediabetes. An HbA1c level of 6.5% or higher is diagnostic of diabetes. Random blood sugar test. A blood sample is taken at any time, regardless of when the individual last ate. A random blood glucose level of 140 to 199 mg per deciliter suggests the possibility of prediabetes. For a definitive diagnosis, other tests like FPG or OGTT may be required. The bottom line here is, if you suspect you may be likely to develop type 1 diabetes by the way you feel or your family history, it's essential that you get in to see your doctor right away. This is not something you want to ignore. Good luck, and we wish you the best outcome. Thanks for watching today, and we will talk again soon.